Part 2, Vaginal Odor continues. Welcome to another episode of Medication Station with Mello, your hub for essential drug and health information. As a pharmacist, my aim is to empower you with knowledge for educational purposes only. Always consult a trusted licensed medical professional for individualized advice. In part 1 of this topic, we talked about what was considered normal and what were the common causes of vaginal odor. Now, in part 2, we are going to continue on to prevention and treatment of vaginal odor. So let's get started, shall we? Prevention. Number 1 on my list is personal hygiene. The vagina is a self-cleaning machine. If you have to clean, just use only water and no chemicals. If you do have to use soap, make sure it is unscented soap. Number 2 on my list, when you use the restroom, always clean from front to back, never the other way around. Number 3, wear breathable clothing so air can circulate around that area. Number 4, change your undergarment as often as necessary, especially after exercise, to prevent moisture from accumulating around that area, thereby causing a yeast infection. Number 5, consider sleeping without underwear just to allow air to circulate around that area so it can breathe. Number 6, shower immediately after swimming, especially swimming in chlorinated water. Number 7, take vitamin C products to boost your immune system so your body can regulate pH naturally. And also consider taking some probiotics, especially ones that contain lactobacillus, which is the good bacteria found in the vaginal area for prevention of vaginal odor. Number 8, avoid foods that have strong odor, such as onions, garlic, asparagus, cabbage, blue cheese, and fish. Number 9, clean your sex toys thoroughly after use. Number 10, do not douche. Douching can alter your vaginal pH, thereby leading to vaginal odor. Number 11, use condoms. Condoms will prevent the semen from altering the vaginal pH. Number 12, lose weight. It may not seem as a big deal, but sometimes when you're overweight, you perspire around that area, thereby limiting air circulation in that area, and thereby causing vaginal odor and yeast infections. Number 13, hydration. Drinking sufficient water can help flush out excess sugar, which when metabolized can promote the growth of odor-causing bacteria. Number 14, avoid using panty liners. Use them only when necessary because panty liners will prevent air from circulating freely around that area. And if you have to use panty liners, make sure they are not scented. Number 15, balanced diet. Eating a balanced diet helps your body's natural ability to regulate pH. Now let's move on to treatment. The key to treating vaginal odor is to make sure the vagina stays acidic, as mentioned in part 1 of our video. The first treatment we have is taking probiotics. But just make sure your probiotics contain lactobacillus, which is the good bacteria that helps to prevent vaginal odor. So you can take a probiotic every day, which is found over the counter. The second is using products over the counter that will help to balance your vaginal pH. You have products like vaginal washes such as Vagisil. You have pH gels like Refresh, and you also have boric acid suppositories over the counter, which can all be used, just to mention a few. The third is put a tablespoon of apple cider vinegar in a cup of water and drink every single day. The fourth is you can actually take a bath with a little bit of apple cider vinegar in it. That also helps. The fifth, you can actually add a cup of baking soda into your bath water and soak in it for 20 minutes. The sixth is hyaluronic acid found over the counter, which can help with vaginal dryness, itching, and moisture. The seventh is just eating fresh fruits and vegetables, organic fresh fruits and vegetables if you can. That is it. Just eating that to help boost your immune system. The eighth is treating a yeast infection. We talked about what a yeast infection looks like in part 1 of the video. So if you have a yeast infection, there are antifungal products over the counter that you can use. For instance, there's clotrimazole, miconazole, and if you prefer to see a doctor, you can get a single dose tablet of diflucan to take to treat your yeast infection. The ninth is bacterial vaginosis. This, if you have bacterial vaginosis, it has to be diagnosed by the doctor and treated by the doctor. In this case, they will probably give you a round of metronidazole or clindamycin to treat your bacterial vaginosis. So it's very important that you consult your healthcare provider if you have any vaginal odor concerns at all. They are the ones who are able to do the proper diagnosis and recommend the best treatment for your condition. This brings us to the end of our topic for today. Thank you for watching. If you did not know all this, now you know. Hope you found this information valuable. Please subscribe, share, and comment below as to what topics you would want us to discuss in the future. So long, Mellow.